Adolescent suicide, risk and protective factors, prevention and treatment. This lecture will help you understand that suicide is 100% preventable. It will show you the risk factors and protective factors for suicide, the steps to take to help those around you, and provide you with the available resources and treatment. Suicide is defined as the act or an instance of taking one's own life voluntarily and intentionally. Suicide is the third leading cause of death among American youths. Boys are at a greater risk of suicide by a ratio of 4-to-1 compared to girls, and LGBTQ+ youth attempt suicide 3 times as often as other adolescents. When talking about adolescent suicide, it helps to understand what factors could make it more or less likely they will consider or attempt suicide. Risk factors increase the likelihood that the individual will attempt suicide. On the other hand, protective factors decrease the likelihood that an individual will attempt suicide. Please take a moment to familiarize yourself with both the risk and protective factors. Now you know the factors that either protect or put adolescents at risk for suicide, but what can you do to prevent suicide? Well, it all comes down to LEARN, L-E-A-R-N. In the Forefront is a program through the University of Washington that provides LEARN training. You can visit their website, www.intheforefront.org, to download their LEARN model training in further detail, but we will discuss it briefly over the next few slides. The first step in LEARN is L, look for warning signs. Any talk of death, self-harm, or wishing they were never born. Looking for access to guns, pills, knives, or other objects that could be used for a suicide attempt. Expressing helplessness, feeling they are trapped and that things will never change. Feelings of guilt, shame, and being a burden to others. Making a will and giving away possessions. Unexpected visits and saying goodbye as if they won't see you again. Increasing social isolation and desire to be left alone. Increased drug and alcohol use, reckless driving, and taking unnecessary risk. It is important to remember that the warning signs of suicide are not always obvious, and not everyone will show warning signs. The second step is E, empathize and listen. Empathy is the ability to understand and share the feelings of another. It is the ability to feel with people. Empathy is very different than sympathy, and there are 4 qualities of empathy, and those 4 qualities are perspective taking, staying out of judgment, recognizing emotion, and communicating. The third step is A, ask about suicide. This may seem awkward, and you may feel like it is an impossible thing to do, but asking about suicide does not, let me repeat, does not increase risk. You will not cause someone to act on it by asking. Sharing suicidal thoughts reduces feelings of isolation, and talking generally provides comfort and some relief. The fourth step is R, reduce the danger. This is where you take away anything that could be used as a means for taking someone's life. Lock and limit access to medications, alcohol, and firearms. Also, continue to support by listening and asking how they are doing. The fifth and final step is N, next steps. Don't ignore comments about suicide, violence, or harm to self or others. If you feel someone is at risk, please call emergency services or the suicide hotline immediately. You can ask someone around you to call while you stay with the individual. Social media has also started to implement ways you can help through their websites. There are numerous resources available, and sometimes we all need support. The Suicide Prevention Lifeline, the You Matter campaign, and the American Foundation for Suicide Prevention are just a few of the resources available. Once the suicidal crisis is over, treatment should begin immediately. Treatment can be done through individual therapy. Individual therapy involves just the individual and a licensed professional. Together, they will work through the feelings and suicidal thoughts of the individual. Family therapy can also be utilized, and this helps the family learn how to cope with the issue and work together to create a supportive environment for the individual. Sometimes, in the most severe and dire cases, hospitalization will be required. This provides a safe and secure environment for the individual, and they can be constantly monitored. During the hospitalization, individual and family therapy may be utilized. Now that you know the risk factors, protective factors, prevention, and treatment, what can you do right now to help those around you that may be contemplating suicide? There are 10 very important steps that you can take to help prevent suicide. Step 1. Remove the stigma. The most important thing we can do is talk about it. Step 2. Stop saying committed suicide. Instead, say die by suicide or took their own life. Step 3. Stop joking about suicide. Don't say phrases like I should just kill myself. Step 4. You should always listen to those around you. Step 5. You should always be an advocate. Step 6. Reach out to people you know are struggling. Step 7. Show compassion. Step 8. Reduce the fear and shame. Step 9. Know the resources. And lastly, but most importantly, step 10. I'm going to ask you to take out your phone at this very moment. Do you have it? Okay. For the 10th step, please put the suicide hotline phone number in your phone. That number is 1-800-273-8255. Hopefully, you now have the knowledge and resources to help those around you. Thank you for taking the time to listen to this lecture.